Welcome everyone to the final speaker in our alumni speaker series this spring, the 7th of our 7 speakers. We are going to do another 7 round in the fall, so we hope you'll tune in for the next round of 7 speakers. We'll do them by Zoom again, of course. We are also excited to remind you, though, that we do have our bonus talk next week, next Wednesday. We've invited our philosopher in residence, Tom Morris, class of 74, and he's going to summarize some of the highlights of this spring and help us kind of work through a conversation about surviving times like these and maybe even thriving in challenging times like these. So we'll all look forward to that next Wednesday at 4. I have to say, when we reached out to Emma Din, class of 2011, earlier in the spring and asked her to be one of our 7 speakers, she very understandably asked if she could. She wanted to do it, but she wanted to be one of the last slots available. So we put her in the very last slot because at the time she was super busy. She was leading the mobilization of USAID funding for Senegal for the response to COVID-19. So she had her hands quite full. Emma, we are not assuming that things have gotten any less busy. So we're really, really grateful to you for being with us and for sharing your story from the front lines.
Thanks, Megan, for the introduction. So as she mentioned, I'm a Foreign Service Officer for USAID, and I've been living in Dakar for 3 years. So for the past few months, I've had the unique opportunity of mobilizing USAID's COVID-19 response, as Megan said. I don't know how familiar many of you are with West Africa, so I'm going to paint a picture of Senegal, which is where I am. So it's the westernmost country on the continent. We actually have the westernmost point on the continent, not even like maybe a mile from where I live, not even. It's a country where multiple ethnicities and religions live together and coexist very peacefully. Over 60% of the population is under the age of 25, and households are very multi-generational. So it's not uncommon to have 9 or more people living in a home. And because polygamy is legal here, a man can technically have up to 4 wives, first time in that type of context. But also most of the population relies on daily income earning. So 47% of the population is below the poverty line. And I think something that's critically important to how COVID has played out here is that the most important societal value is solidarity. So Senegal reported its first positive case on March 2nd. And the increase was slow at first, which gave those of us working in the health space some much needed time to prepare the health system and really ensure that we were all coordinating. We knew how quickly the situation could change. So health system wise, Senegal is a place where there's not a lot of financing for many health problems. So your typical infant mortality, malaria, HIV, TB, etc. And I think more importantly, there's a critical lack of access to quality health services and insufficient coordination across different levels of government. So the goal of my job here as an FSO is to really support the government of Senegal in increasing their capacity and commitment to provide quality health services. So that's basically a fancy way of saying that I'm a program manager. And in the current crisis, I've added on managing our COVID response activities on top of my normal job. So the day-to-day since the start of the crisis can be grouped into 4 main categories. The first has been setting strategy. The second was defining the country's need. The third was mobilizing funding, and that's when Megan reached out. And the fourth has been adapting programming to the local context. So as I've had to think through the challenges of responding to COVID in a low resource setting, I've learned 7 important lessons that I'm going to frame my talk around today. So lesson number 1, there is no perfect decision. There are always trade-offs, and you just have to weigh the pros and cons and then make the best decision you can with what you know. So as Senegal was setting strategy and defining its national COVID strategy, there was a critical decision to make about how to isolate patients. They could either isolate them at home or isolate them in treatment centers. So if they went the home isolation route, obviously that would place less strain on the health system. But given the current realities of what home life is like, there was real risk there. And the other hand, right, isolating people in health centers and other centers really risks overwhelming the health system. So we encouraged the government to actually go the home isolation route, but they opted instead to impose strong movement restriction measures early on to decrease the number of positive cases that there would be, and then require everyone who was positive to isolate in treatment centers. So it mostly worked. For several months, we had a curfew from 8 p.m. until 6 in the morning. There was reduced public transit. We weren't allowed to travel in between regions in the country. I think similar to the US, right? Like restaurants, bars, gyms, places of worship closed. And there was a noticeable decline in cases. I think something else that's important about this context, so as I mentioned, solidarity. People really came together, but also, if I had to be honest, if I had to be in a place during a crisis, I would rather be in a place that has more authoritarian government. The government had the power, right, to impose measures that people would respect and listen to. And so to date, Senegal only has about 4,700 cases of COVID and has had 54 deaths. So the takeaway here is, even when you don't have a lot of resources, be decisive and take aggressive action early. Lesson number 2, it's not worth dwelling on the unknowns, especially if they're beyond your control. So Congress actually approved about $1 billion of emergency funding for USAID to spend on COVID in over 100 countries. And it's a weird system. Even though I work for USAID, I still had to apply for funding from headquarters in Washington, making the case for why Senegal deserved that funding. And like any organization, data and numbers really resonate. The struggle in a low resource setting, though, is that a lot is paper-based, and even with the electronic information system, there's a lot of incomplete data. So I couldn't get clear numbers when writing these proposals. And that could either be right, because the government didn't know what stock they had on hand nationwide, or it could be that they didn't want to tell health donors. And honestly, I don't really blame them. This is a crisis that doesn't have a clear end. Who wouldn't want to get more resources just to be safe? But from a funding proposal perspective, it was really challenging. I spent a week really like hitting my head against the wall trying to get clear numbers. And finally, I just triangulated data the best I could and wrote a proposal to move things forward. So this takeaway is just make your best educated guess with the resources and information you have and move forward. Lesson number 3, whether you like it or not, international aid is geopolitical. So I was really proud of myself because I'd succeeded in securing $6 million for USAID to respond to COVID in Senegal. But unfortunately, right before I secured that funding, the White House issued an executive order in late March that banned any US government funding from being used to buy COVID commodities that were in shortage in the US. So that means no masks, no gloves, no testing kits, etc. So it was incredibly frustrating to have so much money and not be able to address the most pressing and critical needs of the country. Obviously, we found ways to still implement the funding and target it towards important activities. But the reality is that we were asking Senegalese health workers and community volunteers to expose themselves in high-risk settings to implement response activities. And I think even beyond that, when the US takes a policy decision that leaves a void or doesn't allow it to fulfill a need, other governments or donors will definitely step in to fill that role. And so this has changed how the US is viewed in the world. And I've personally seen how it's affected our relationships with the government of Senegal. Lesson 4, when you're facing a challenging problem or situation, actively seek out new ideas and counterintuitive solutions. Question the status quo. So the crisis has really forced my team here to examine how things are done and have been done in the past. And as I've been thinking about it in preparing this talk, I realized we didn't really need to wait until the crisis happened to question how things were happening. So case in point right now, how it applies to COVID, social distancing is incredibly important, but how can you ask Senegalese families to remain 6 feet apart from each other? So I've mentioned how households are multi-generational, how they're large in size, how people leave each day to go earn money that they need to feed their family. But beyond that, even meals, like you'll find that people share the same large plate and eat the meal together, sharing silverware, sharing cups of tea. The oldest family member, often the grandparent, also shares a bed with the youngest family member. So how to adapt social distancing in this context so that it actually was adopted and feasible has been a question that we're struggling with. I still don't have the answer. And I've accepted that I don't have to have and can't have all the answers. And so the takeaway here is being willing to recognize your limits and figure out who you can tap to provide needed answers. So we are working with other government agencies and just various stakeholders outside of the government, particularly civil society, to figure out how we can answer this. Lesson number 5, unprecedented times are a unique opportunity for creativity and innovation. You could argue even that they demand this. So if you've been to the continent, you know that Africans are strong, resilient, and creative. Despite the challenges of a low resource setting, I've been continually impressed by the solidarity and innovation that I've seen. So the president on the government side created a $1.6 billion response and solidarity fund to help those who were impacted by the loss of work. But even beyond that, painters are making beautiful murals in the street to promote healthy behaviors. Tailors have created these awesome like wax print face masks that match head wraps so that women actually want to wear them, and even beyond women, that people want to wear them. Students are working on COVID rapid diagnostic tests. Religious leaders are using their influence to promote communication efforts. The car rapide, which is the local name here for those local buses that are overstuffed with people and animals, they've even been implementing physical distancing because they've been at maximum 50% capacity. So the communities really come together. And I've realized life will always bring challenges, but think about how you can use your unique gifts or abilities to help make things better. It's funny because I never considered my ability to communicate, work well with others, or even problem solve particularly noteworthy. I consider it pretty basic in this job market, but I've seen what a difference it can make. So don't underestimate the impact of your natural abilities. Lesson number 6, it's a marathon, not a sprint. When my supervisor asked me to coordinate the COVID response, I dove in. The perfectionist in me worked overtime to do this full-time COVID job, plus my normal responsibilities. And 6 weeks later, no one will probably be surprised to hear that I was burning out. I wasn't sleeping well. I was waking up in the middle of the night and in the morning with like my to-do list still running through my head and having drafted emails, even though I'd been asleep. I was overwhelmed. I just was drained globally. And I've realized whether it's school or your job, others will take everything that you're willing to give. So remember that part of your job is ensuring your emotional well-being so that you can continue to be productive. So do what you need to do to take care of yourself and set boundaries, however that is. And the last lesson, number 7, rethink Africa. There's still an important role for donors here, but the continent is not waiting for Westerners to come and rescue them. The US government has been instrumental, and it's been awesome to feel that I've been a critical part of the response. But I've also been impressed by the ingenuity and innovation that I've seen from the Senegalese people themselves. So people like to say that Africa is the future, but I say that Africa is now. And that's it. I'm not a clinician and I can't predict the future, but I will answer any questions that I can.
Awesome, Emma, amazing. I see applause everywhere. I don't know if you got it on your speaker view or the other group view, but you're getting a lot of applause. So thanks for that. And I love that you chose to give 7 bits of.
That was intentional.
I love that. Thank you. Very good. Very, goes with the theme. And just reminding everyone, there are several ways to ask a question. You can just unmute yourself and have a go. And ask your question. You can also use the chat feature to type it in, and I'll be happy to read those to Emma so she doesn't have to keep looking to see if there's a new question. Or you can raise your hand using the hand raise feature or your visible raised hand. So jump on in if anybody's got a question now.
I have a question. Hi, Emma. Nice to meet you virtually. I have a question that I feel like I have to ask because I'm currently working on a job where we are getting a lot of data from partner sites in Africa that are different health systems from different countries where they use DHIS2 and HMIS data collection. And as you were mentioning, we're supposed to be using it for COVID surveillance and indicators, but there's a lot of struggles with getting it because of paper data collection and people manually entering it. And so I was curious if you could at all speak to what is being done for data collection and health systems and like health information systems in Senegal, what the solutions are to try to get good routine data so that you can make these kinds of asks with USAID.
Yeah, so that's a very pertinent question. Data, I think if you talk to anyone working here right now, they'll mention that it's a pain point. So kind of pre-COVID, right? So USAID has funded the CDHS, and really we fund a lot of activities to encourage the operational level to input data, not only into DHIS2, but also IRIS, which is like the HR version of the information system. And so it was going well before, right? So the complication though is, while I've been here, so I think it's 2 years at this point, there was a health data strike. So there's a lot of incomplete information already leading to this, but also, right, like the DHIS2 system, it wasn't the exact kind of data that we needed in terms of a crisis. So this is where IRIS would have actually been more useful. We were struggling to know, like, how many healthcare workers do we have nationwide? How many beds do we have nationwide? How many ventilators do we have nationwide? The government could talk about Dakar, the capital in the region, but they couldn't quantify what existed nationally. And so related to the data side, we've been using this to continue to really push the need for Senegal to do SPA, because that would have given us a lot of information that we needed to actually fill, like, complete and input data into IRIS, which we've been funding for several years. Obviously, right, with like digital strategy, we're looking at ways that even if it's not in the government system, in a crisis, we can get data more real time, and that's still ongoing. I think the reality with the funding that we've gotten for COVID, all of it is going to like risk communication, coordination and planning, infection prevention and control. We're still in that first stage of responding to the immediate needs, but we've definitely flagged that as this continues, there is a need to really reinforce the monitoring systems, especially tracking data for deaths that aren't explicitly COVID-19 related, because due to infection prevention measures that have been put in place, people are reluctant to report COVID deaths because they just want to be able to bury family members the way they want. So the short answer is it's still a work in progress.
And Don, class of 2021, just want to, if you jump in with a question, you can say where you are or what year you are. Mack Harrell also has a question. He is a medical fellow, and he's wondering, one of our Morehead-Cain medical fellows. He said, I understand there's a Pasteur Institute branch in Dakar. Are you interacting with them in the testing arena?
Yes. So Institut Pasteur is our lead lab for COVID. So this was not a lesson, but something that I've learned is that a crisis is also an instance for posturing and positioning for local actors. And so the response struggled at the beginning, like coordination around it, because I think people saw with Ebola that this is an opportunity to show like how well you can do things to kind of get promoted later. And so IPD, Institut Pasteur, was the only accredited lab up until a few weeks ago, even though we have private sector labs that could be testing, and we have other, like, lab capacity in country could be so much more if it wasn't all channeled just through IPD. So ERSF is a second lab that was approved in May to officially be a COVID tester for the government, but we're not utilizing the full lab capacity that we could if we tapped into private sector labs. And then regarding Institut Pasteur, though, and their role, so they've been integral from the start. So every morning, there are daily emergency response meetings that are led by the government, and it includes, right, the labs, health donors, government stakeholders, both at the central level and regional levels when needed. It includes the military. So it's really a comprehensive meeting. And a particular struggle on the lab side, though, is that even though like we have gene expert machines or Abbott machines, we have machines to be able to test, but not the reagents. So the limiting factor here isn't like, oh, is there the machine, but we don't have the supplies to be able to test more than like 1,000 to 1,500 people per day.
We have another question. David Roan, class of '85, is asking, is the Gates Foundation, are there others active in the region? Are they helpful with short-term or long-term health efforts there?
Yeah, so Gates was more present before. They were more particularly invested in the supply chain. Right now, the leading health donors are WHO, USAID. We also, for COVID particularly, the Red Cross, CHAI is here helping a lot with lab strengthening and logistics. There's JICA, well, JICA is not playing as much of a role. So there are many health donors in Senegal, but I would say for COVID, the leading ones have definitely been UNICEF, WHO, USAID, CHAI, and the Red Cross.
And Peter McCullough, class of '86, wonders what are the immigration limits, if any, to traveling to and from Senegal, to and from the United States? Sorry, can you return to the US or can you return to Senegal if you come back?
Yes, so I mentioned, so the first case was March 2nd, and then when the state of emergency was declared March 23rd, part of the restrictions imposed was that the airspace was closed. So it was closed except for special authorizations, which include like cargo flights and repatriation flights. So it's not an automatic guarantee that just because like an airline like Delta wanted to do one that they would get to. So it's a negotiation with the government. There have been several repatriation flights. Delta's actually doing one tomorrow. So now that Senegal is kind of entering a second phase where they're slowly reopening. And so I'm predicting that there will be more frequent flights, but during the like first 3 months of the crisis, there were a limited number of repatriation flights. And actually, interestingly, the main motivation for it, for the government of Senegal, was that there are Senegalese who are stuck in the US. So the deal was that like, Delta has been bringing Senegalese people back to Senegal. And then for that return flight, they've been able to repatriate Americans.
Awesome. Sarah Lorena D, class of '85, wonders, when you say that other countries stepped in to fill the void in the holes left by the US, declining to fund any materials that were needed in the US, which countries stepped in?
China. Yes, that was my attempt to be subtle. So yes, the reality is that there is a very clear, I'll call it a popularity contest on the continent between the US and China for who is the better partner. There's definite differences between aid and assistance that USAID brings versus the Chinese government. So this PPE pause that actually is still ongoing 3 months later, and we received like revised guidance yesterday that creates some exceptions, but honestly, the PPE pause is what strained our relationship with the government most, because it's a crisis, right? They need masks, gloves, beyond PPEs, right? Like I talked about how for the labs, they have the machines, but not the reagents or the testing kits, and all of that was on the non-authorized list. So every time we would go to these daily meetings, the government of Senegal would be like, so USAID, what are you going to help us? Or when are you going to provide something that we actually really want and need? And it was particularly heightened because we originally had a shipment of PPEs that was coming to Senegal from an emergency stockpile that was created in Dubai after the Ebola response. And Congress designated that it could only be used in developing countries. But because of the shortage that was happening in the US and all of the media attention on it in March, that shipment was actually also paused. So we'd already communicated that it was on its way. And this is like 2,000 PPE kits. And then we had to be like, sorry, we not only can not tell you when this is coming, but we can't purchase it with the money we do have here. And so China really stepped up. So both the government and private sector and philanthropy. So the Alibaba and the Jack Ma Foundation shipped in early April, like PPE kits to all 54 countries in Africa. And beyond that, the government has also provided supplies. So the void that we left, the Chinese government or Chinese organizations have been very quick to fill.
Jeremy Kelly, class of 1990, is wondering how do the mortality rates in Senegal compare year on year for the past 2 to 3 months?
Wait, sorry, make sure I understood. Was that mortality for COVID?
Oh, good, Jeremy, yes.
This is general mortality in the population, because with all the testing, so many cases don't get caught by the testing. And there was an interesting article in the Times today, just looking at the mortality rates on a year-on-year basis, and how, you know, you've got places like New York City, which are over 5 times the mortality rate than they were a year ago. And I just thought it's an interesting metric, just given all the challenges around testing. And just, you know, have you seen anything in Senegal on that basis?
Yeah, so I don't actually know how the general mortality numbers have changed. I haven't received aggregated data about it, but it's definitely something that we've been thinking about since the beginning, particularly because of limited testing. And one of our proposals actually was to use emergency funding to set up kind of like an early warning system by just tracking general mortality at the community level, so that if there was a spike compared to past years, even if it wasn't being reported as a COVID death, we would be alerted that something was going on. It was not approved because we're still in the emergency response. So they're very clear kind of like emergency response domains versus later stage domains. And so we're trying to figure out how to fund it. But I think your point is absolutely valid. And like we keep using Ebola as a reference, what we've seen with past health crises is that there's actually much more mortality linked to indirect causes of the outbreak. So in this case, right, people who aren't receiving health services for vaccine or other preventable diseases or illnesses because COVID has displaced that compared to actual COVID deaths. So our team, it's not within, I'm not working on it specifically, but we do have a sub-team in our office that's working with the Ministry of Health on how to ensure continuity of essential health services. But there hasn't been that kind of aggregated mortality data that's been shared widely the past couple months. But actually, though, I think through some, so kind of like offline meetings that we've had, it's through data we have seen that hasn't been made public that we became alerted to community transmission and also realized this issue we have of people not reporting COVID deaths. Because even though the official numbers, for example, say 50, like as of today, it's 55 deaths. We were discussing on Tuesday how there's like a district in Dakar that had 7 deaths in 1 week, which is not normal. And so that's flagged for us that even if it's not being coded as a COVID death, there's probably more COVID deaths than we've realized.
You may know this next person, Hogan Medlin, has a question.
Emma, we're both from the class of 2011. So a bit cheeky, I hope we can find ways to order these wax masks you're talking about because they sound awesome. I'm asking a question as a fellow healthcare person. I work for UNC Health, and we are seeing here in the States, particularly in the Triangle where there's so many health institutions, a lot of innovation spurring from COVID and the rapid need to respond and change our operations, create new ways of testing people and what does a waiting room now look like, or even in our facilities. I mean, everything's changing. What are you seeing in the innovation space in Senegal in terms of healthcare based on COVID and what you all are going through in Dakar?
Yeah, so I definitely say, right, the research and time going into developing rapid diagnostic tests. So they're antibody tests. So it wouldn't be a test to detect, like, do you have COVID now, but it would be more so whether you've been exposed to it. I would say what we're seeing in the media is definitely what we're hoping for, not actually what's been achieved. So they haven't yet achieved the sensitivity and specificity that we'd hope for in terms of results, but there's been major progress made, and we're all optimistic that hopefully one of these cheap tests will be able to be used for testing. I think also, I had a second example that came to mind immediately. Oh yeah, so it's not so much in, well, okay, so it's on the like risk communication and community engagement side, right? So using mobile platforms a lot more. So I think that normally when we think about communication efforts, like the traditional development response is like, the communication campaign should be through like TV and radio, which we're definitely doing, but I think that there's a lot of innovation in using the social media platforms of WhatsApp and Facebook, especially because we have a young population that's reaching people a lot more and focusing on like targeting rumors and myths through those social media platforms. I think that probably the other like big group of like bucket of innovations that I've been exposed to is less so like, oh, did we create this product, but really thinking about how we can adapt this like international practice or international regulations to the local context. So, I mean, it's not as like flashy, but really like task sharing, there's a lot of home-based care through community health workers that happens in our regular health programming. So how we can give like thermoflash to community health workers to enable them to do home-based visits still. I think it's that bucket of rethinking how we provide health service delivery. And there's a tendency to think that if it's not formally done, then we're doing something wrong. But there's a lot of thinking about how it can be done informally, but still achieve the same, if not better, results.
Awesome, thanks, Hogan and Emma. Locke Kerker, class of 95, asks, we've seen some dramatic impacts on animal agriculture and food supply logistics in the US. What have been the impacts on the food supply chain due to COVID or the response to COVID in Senegal?
So this question is actually one of the main reasons that the embassy here allowed a lot of staff to go on authorized departure back to the US, because there were significant concerns about the food supply chain and if we'd run out of electricity or gas, etc. Personally, I haven't experienced any impact. So Senegal doesn't do a grid system. Like there are sometimes internet outages or power outages, but it's not like an organized, routine, regular thing. So I haven't experienced outages any more than I have in the past. And grocery store wise, I would say so the ports have still been allowed to bring in, so like cargo that's for food, fuel, etc., similar to the airport. So the movement restrictions, honestly, it didn't end up having that negative impact that we were all waiting for. I like super stocked up my freezer, my pantry, and I haven't had to use any of it actually for emergency reasons. I think the bigger impact has really been economical. And it could be that one, our border points are maybe more porous than we'd like to admit, but I think it's really that the government intentionally left the port and airport open still for supply chain needs.
Gare McCullough, class of 84, wants you to finish a sentence. Personally or professionally, how have you been completing the sentence? When this pandemic is over,
I'm going on a vacation. Definitely. I was actually talking to a coworker about this the other day, where there's a phased approach to reopening. There's a phase, both like the country reopening, but also the embassy reopening, so that we all work there in person rather than remotely. And I am in dire need of a vacation. It's maybe the scholarship's fault that I've just become super used to being able to travel frequently. But it's the longest I've gone without traveling, even if it's just like within the country. So I'm definitely getting stir crazy. I spend 99% of my time in my apartment. So yeah, I was talking to a coworker actually on Tuesday and telling her that even if it means risking coming back to Senegal and having to be quarantined for 2 weeks, I plan to take a vacation ASAP.
Great. Mack Harrell has a question for you. Did you want to answer that yourself, Matt?
Hi, Emma.
Hi.
So I'm interested in what language you speak for most of your transactions during the day.
French. So yes, French. So there's like over 5 local languages. So I have some basic Wolof. Wolof is the main one. But my Wolof is only enough to make people think that I'm Senegalese, combined with my like Senegalese hairstyle. And then I'm quickly like, no, French.
you're getting some love in the chat here. Just folks are saying, hope you have a great vacation very soon. And, talking about how impressive you are. Have I missed anyone's questions? I think I may have grabbed everybody so far.
And I actually have one more thing to add really fast. This is actually in response to Hogan's. I don't know if he's still on the line. So I wouldn't put it, well, you can maybe put it in the innovation box. So something that Senegal has been doing is hydrochloroquine treatment. And even though, so the findings, so it's not by no means a clinical trial, but the results have been positive. So pretty early on, even when the whole world was like, should we do this? Should we not? Kind of with that, when you have limited resources, just take aggressive action and make a decision and move forward with it. The government definitely did that. They started treating all patients with hydrochloroquine who didn't have like side effects or weren't contraindicated for it. I would say like a few weeks in, which was very bold. And so there hasn't been a clinical study, and really they're kind of serving as a control to themselves. So they're comparing the people who couldn't take hydrochloroquine because they were pregnant or whatnot to those who are. But they found that those who are taking it are recovering about 4 days faster. So I don't know if that's in the innovation box, but it's been pretty interesting.
Sandy Shaw has a question, class of 66.
Emma, I'd like to ask a non-medical question, if I may. Several years ago, prior to a trip to Southern Africa, I first learned about the African philosophy of Ubuntu, which is a multifaceted, positive attitude toward human society. Humanity is one of the translations for the word. My favorite poetic definition is one cannot be fully human except through relationship with other human beings. And I wonder if you've seen this play out in your work in Senegal.
Definitely. So I think that, right, that respect for others translates into this. So definitely the societal value of solidarity and standing together and supporting those who have less. It's also part of, right, the respect for elders and living together ignore that word, living together regardless of the generation in the same household. But I would definitely say day to day, even though it's not called Ubuntu here, it's here, it's Senegalese people pride themselves on hospitality. That's how they phrase it. And so whether you're Senegalese, whether you're from another country, there's this sense of valuing individuals and humanity and really respecting that.
Tom Morris, would you like to ask a question?
Yes. Hey, thank you for this, Emma. This has been very, very enlightening. My question is this. Has this been a time of massive personal growth for you as a person emotionally and intellectually, or rather have past times of personal growth prepared you for this moment? And it's just been a kind of practice of what you previously learned. Kind of part two of the question, whichever that is, whether this has been a time of massive personal growth for you or whether past growth has prepared you for this, what's the most salient point that we might be interested in hearing for dealing with crises like this, where you're just dropped into an environment where so much is on your shoulders? That's my question.
No, that's a great one. So I would definitely say that this crisis has probably more so capitalized on past experiences that I've had, so I've definitely, I would say the growth that I've had most in responding to the crisis has actually been the emotional side one, and really it's a marathon, not a sprint, not burning out, setting boundaries for myself and figuring out how to cope, especially as an extrovert. Like, I think it's been a crisis that I haven't just been responding to externally, but I've also been living. And so that for me has been what's impacted me the most. But in terms of my ability to like mobilize this response, it's funny because in grad school, so I guess to maybe like give some context, I'm not a doctor. I officially joined USAID's Foreign Service in 2016. I remember studying, right, like the Ebola crisis and thinking like, wow, all of the like learning and experience that those who were responding must have needed. And like what I've realized, and this is not the same as Ebola, but what I've realized in being in this crisis and leading the response is you don't need to be a COVID expert, which is what I'd always thought. It's really those fundamental skills of like critical thinking, problem solving, communication. And I think that's a huge part of the reason why, even though I'm actually one of the most junior members on our team, my boss asked me to lead and coordinate the response. And it's because I think you can develop those skills in a variety of ways. It's not just like, how old are you or how long have you been in the workforce, but really those fundamental skills. And I've definitely become professionally, I feel like I don't call myself a COVID expert, but way more of a COVID expert. And I went to grad school for like health system strengthening. So this kind of like systems thinking is very much up my alley. But having to work with a lot of different personalities, a lot of different people, it's really back to those basics, I think, that have made me most effective. I really never realized the value of just being able to like get things done. Like, people will happily sit around a room and share their opinion all day. And I think my personality is just like, okay, so next steps, how do we move this forward? Like, let's go, team, woo!
That's good. Good answer.
Emily Bowe, class of 2014, has a question for you.
Hi, Emma. It's been a few years since we last saw each other, but I'm waving at you from across an ocean. So I think you may know this, but part of my study abroad was in Senegal. And so one of the most interesting things when I was there, it was during the 2012 presidential election, which was its own kind of like thing. But one of the most interesting things I saw was kind of like the politics of communication around what was communicated in French and what was being communicated in Wolof or other languages, and when those things were communicated. And in preparation for the call, I was doing a little Googling and I saw there's like a mini series or like a short series that was called Dr. Diop that was all in Wolof that was being broadcast over like social media channels. And anyways, it struck me as like, that's pretty significant that it was basically a, like a public health outreach tactic only in Wolof. And so anyways, I just wanted to get your perspective on what that's been like in terms of navigating the politics of language in a country where there are multiple, it differs mostly by like rural and urban, but like where there are different languages you have to really think about.
Yeah, so I'm going to respond to your question and even add a second way that communication has been politicized, which is who has the information. So in terms of language, that was definitely an aspect, linking it back to the last question, of professional growth, right? Because especially in Dakar, but among like more educated Senegalese, everything is done in French. And so one of the things, as you know, that makes Senegal interesting is even though there are many different cultural groups, like ethnicities, all of them speak Wolof. So it's not that each one has their own and can't communicate with the others, so everyone must therefore speak in French, but they all speak French, or they all speak Wolof. And so the cool thing on the communication side has been that there's really been a strong emphasis, at least with our USAID funding, and I know the government's made a priority as well, to not just do things in French or even like Wolof, Jola, Serer, but also even further to think about how to communicate with people who aren't literate. So there's been a lot of communication efforts done in Wolofal, which I had no idea what that was before, but it's kind of a mix of Wolof and Arabic, and it's intentionally meant to communicate to people who aren't literate. So it's been really interesting to learn about Wolofal as a communication strategy, in addition to, right, the more like audio type communications. But the second piece I wanted to add about the politicization of communication, so who has the information in COVID has been something that people are holding on to. So it relates to what I was saying about there being a reality of posturing during the crisis. And so it took a while at the beginning, but there's so first of all, there was already political tension about who would be the lead government agency or the lead person leading the response. But there were daily evening updates, which I think did a really good job of making sure that people nationwide stayed informed. So you could either read about it on the Ministry of Health's website, through Twitter or like social media platforms, but also radio stations would broadcast it. And so every day at 9 p.m., there was this broadcast of the COVID data from the day. And so the head of the response would hold on to all of the important updates until that 9 p.m. message, so that he was the one informing everyone. And it really like had a ton of ripple effects, because I remember there were doctors who had like sent samples for testing and were discovering at 9 p.m. through this like public announcement that their patient had been positive. And so there's been the positive side, right, of doing communication in a way to ensure that more of the population is informed, but there's also been this, I mean, I'm not going to call it negative, but other side of people wanting to control who's announcing the information and being seen as like the hero.
Thank you.
Emma, Peter Gilmore has a question. He lives in Ecuador. He said, "Hi, Emma. Thanks for representing our country so well there in these trying times. I also live in a developing country, Ecuador, where the only reliable data was the historic death rate versus the sad daily toll, which fortunately here in Guayaquil has returned to normal levels after 2 terrible months. Now a major concern here is the corruption in nearly every area for the resale of all the donated PPE and medicines at exorbitant prices. It is imperative to insist in controls against these immoral commercial practices. Hopefully you can insist on positive controls in this area. Great work. There will be plenty of time for vacation one day." And apparently there is not really a question in there, but it was a lot of really cool information. So it sounds like he's comparing notes. And if you want to comment on that, that would be fantastic.
Yeah, no, thanks for reading everything in the chat, because since I'm doing this on my phone, I can really only see 4 people, including myself. So yeah, I really think this kind of like COVID in a developing country experience is the same regardless of whether you're on this continent or in Latin America. That is, I mean, so kind of what I said about in the earlier answer, it's exactly what you mentioned, right? Like there isn't a ton of public data. The data is constantly changing, and it's easy for the government to argue what is a bigger priority in terms of data. But what is the case in Ecuador of comparing historical mortality to actuals. So that case from this week, right, where there was a district in Dakar that had 7 deaths in 1 week, which is well above the their norm. That's been helping us identify, 1, hotspots that are kind of sliding under the radar, but 2, other issues that we're not as aware of. But yeah, developing countries, woo!
And Peter McCullough had one more question for you, and that is, experience with SARS prepared many Asian countries for COVID-19. Did Ebola prepare Senegal? And if so, how? And if not, why not?
Yes, 100% yes. So Senegal was used as a response hub in the Ebola response. So this is kind of like their round 2, I think, of responding to a health crisis, but also post-Ebola and pre-COVID. So the US government created the Global Health Security Agenda, which is this huge interagency initiative to really help prepare countries to prevent and respond to global health emergencies, particularly outbreaks that are related to zoonotic diseases. And so before COVID even started, for the past 5 years, USAID, CDC, and DoD have all been collectively funding the government of Senegal to prepare for an outbreak response. We, the USG, funded the Emergency Operations Center. That's where these daily emergency response meetings are happening. We trained the staff. We've been running simulations. And so all of this, right, came out of lessons learned from Ebola. I think that so on one hand, Senegal was definitely in a much better position with the response. But I think on the other hand, we were surprised because given all of that investment, the posturing made a lot of those systems we've put in place not as effective as they could be. So once we got past those posturing issues, it's now been much better coordination and more effective. But I think a risk though, or not a risk, but something that we're working on is a lot of Ebola protocols were kind of copy and pasted for the COVID response. And the reality, and we're seeing this right now with the issues that we're having with burial. There shouldn't be the same restrictions on burying bodies of COVID infected people as there were with Ebola, but because there was this kind of copy paste of protocol, there are really intense infection prevention and control measures that are the existing protocol. And that's why people, they don't want to wait that long to be able to bury loved ones, or they don't want to have to go through all of those procedures. So now that Senegal is kind of entering a reopening stage, and there's a lot less of that urgency, must do everything now and as fast as possible go, we're taking a lot more time to really focus on adapting that international protocol and other protocol to the local context, both developing country, but also COVID realities.
Thank you so much, Emma. Amazing. This has been so wonderful. What a great opportunity for all of us to spend time together and learn more about what goes into managing an international health crisis and all of your great lessons learned. Thanks so much for being here with us this afternoon.
Thank you all for listening. In a global sense, reach out if you want to hear more. I can't promise that I will respond immediately, but I do love, I'm a health systems person, so I do love hearing about how things are being done in other places and any feedback.
Awesome. And we'll actually save the chat and send it to you because you're getting lots of love in the chat. And if you can't read it, we're going to make sure you do. So we'll send it to you, Emma. Yay.
Thank you.
Thank you. Yeah.